Hello and welcome to We Can Do Better, a podcast about ending poverty in our time. My name is Fran Quigley. I'm a law professor. I go with my students every week to eviction court, where we represent some of the millions of people in the United States who are facing the loss of their homes, who are skipping filling prescriptions, and even going hungry despite living in the richest nation in the world. We can do better. Other countries already do far better, and the United States has often done better in the past. So what this podcast does is we lift up the many people and organizations who are working to make housing, healthcare, and a decent life enforceable human rights for all. So this week, we're going to talk about a potential change in the law to the SSI program, Supplemental Security Income. This change could dramatically reduce poverty in the United States. So before we introduce our guests, I'd like to share a few words about why I care about today's topic and why I think you will too. So recently we had a client in eviction court, and I'll call her Dorothy, not her real name. Dorothy is in her mid-70s. She uses a wheelchair. She has some cognitive challenges. She has multiple other chronic debilitating conditions, and Dorothy hasn't been able to work for many years, including when she was younger. But those conditions do allow her to qualify for a government program called SSI, Supplemental Security Income. Here's the thing. Dorothy's monthly SSI check is the maximum program amount of $994. That is less than her monthly rent, not to mention the other costs of living. And some people who are eligible for SSI, like Dorothy, are still waiting to get it. And there's restrictive rules on top of that, which our guest will talk more about today. So we see a lot of people like Dorothy in eviction court, and so do our colleagues who work with chronically homeless people. In fact, many of the 7 million plus people in the United States who are living with disabilities and limited to an SSI check are homeless because of the obvious math problem that Dorothy faces. Their income just does not come close to covering the costs of housing, food, transportation, clothing, and other necessities. So that's why we're excited today to welcome Stephen Nuñez into the show. Stephen is the Director of Stratification Economics at the Roosevelt Institute. The Roosevelt Institute is a think tank, a student network, and the nonprofit partner to the Franklin D. Roosevelt Presidential Library and Museum. So Stephen is an economic sociologist who leads research on systemic inequalities in the economy and the many ways that public policy has perpetuated them. What we're going to talk about today is that along with his colleague, Jack Landry, Stephen wrote a really important March 2026 analysis of a proposed federal law change, which is called the SSI Restoration Act. This has been introduced a few different times, and a version was reintroduced this year by multiple members of Congress, a bipartisan group, which includes, I think, the name most folks would recognize as Senator Elizabeth Warren, but several other folks as well. And Stephen's going to give us the details, but spoiler alert, this legislation could do a lot to help Dorothy. It could do a lot to help so many others. More deserving people who don't get SSI could get it, and a lot less people on SSI would be in poverty. And Stephen will discuss his research, but we're going to put a copy of his paper in the show notes for folks who want to dive deep. So Stephen, welcome to We Can Do Better.
Thank you so much. And I do agree, we could do a lot better.
Yeah, that's the theme. This is a wonderful step in that mission statement of what we can do better. So I mentioned what we see in court, which is obviously just anecdotal, but your report does a terrific job of starting off by here's what SSI is. Here's what the program is. Here's the scope of it today, who's enrolled, what the benefit levels are, what the restrictions are, et cetera. So could walk us through a little bit about what SSI looks like today?
Sure. So Supplemental Security Income helps disabled and impoverished children, adults, and seniors. It is a program that has somewhere around 7.2 to 7.4 million people, depending on the particular year and the particular estimate. About 1 million of those are children. About 2 to 2.2, 2.3 million of those are people 65 and over, many of whom are also receiving OASI, which is what we call Social Security. And this is a program that was created as part of essentially the last time that the Social Security Act of 1935 had a major amendment in 1972. It was signed by Nixon, and it went into effect in 1974. And the idea was to take this patchwork of different disability benefits that existed at the state level since 1935, and to make it into a federal program and standardize it across the states. At the same time, extending it not just to adults, but to children. And at the time, it was a huge, huge improvement over the status quo ante. It set benefits a little bit lower than kind of the median benefit at the time across the various states, which meant that for a lot of people, it was actually almost doubling the amount of money that they were receiving. And it said that this is a benefit that's going to be inflation adjusted over time. And anybody who's currently receiving more because their state is providing more than this sort of baseline benefit is going to continue to receive that higher benefit. States are on the hook for topping that off. And again, at the time, it just did a huge, huge amount of work increasing living standards for households where somebody was, one or more people were disabled. And it represented a really important, I think, platform and a good foundation for us to build a better disability policy going forward. And part of my paper is about why that didn't happen. What's wrong since then?
Well, and part of what you wrote about is not that much has changed since then. We've that's more than 50 years. An awful lot of things have not been updated the way they should.
Yeah.
So go ahead.
If you wanted me to get into that, I think certainly, as I said, the benefit itself is indexed for inflation, and it goes up every year. But the program also has other parts of it that have not been updated, really ever. Before any kind of means testing for the program kicks in, there is an income disregard. The first bit each month of your unearned income, so something like a Social Security check, gets sort of subtracted, and the first little bit of your earned income gets subtracted. And that has been fixed since 1974. $20 per month for unearned and $65 for earned. So that means that the real value of this disregard declined by 84% since 1974. So to put that in kind of terms that maybe somebody could understand, we would say today, an SSI recipient who is working can work no more than 2 hours a week at federal minimum wage before their benefits start to be reduced at 50 cents on the dollar. When the program was first put into place, someone could work for about 10 hours a week at the federal minimum wage before their SSI benefits start to be reduced. So those have never been updated, and that's a very strong and difficult barrier to deal with. It means basically any money that comes into the household is immediately going to start eating away at a benefit that's already quite low.
Right. If somebody does like a gig job or if they get a little gift or help from a family member, that starts counting in there too, and they get penalized there, right?
Yep. And at the same time, it's a program that has an asset test. That asset test has been updated since 1974, but not since 1989. And it's $2,000 for individuals and $3,000 for couples. So this makes it basically impossible to save for retirement or really otherwise. The main impact of that is people having to, watch their bank accounts like a hawk and move things around and deal with an enormous amount of paperwork and burden. But on the margin, something like 70,000 people lose their benefits, at least temporarily, every year because something goes over, briefly.
Well, 70,000 people lose their benefits per year, at least temporarily. Wow.
About 70,000 people have their benefits suspended, and of that, about 40,000 of them actually have their benefits fully terminated.
Wow.
So it does create churn on the margin, and it creates a lot of anxiety and a lot of paperwork to prove that you are in fact below below this. At the same time, that federal benefit, which is going up in terms of inflation, it's indexed in inflation every year. It was never really meant to be on its own sufficient to support people. It was supposed to be attached to these state supplements, and those have basically vanished over since 1974. So the short of it now is that today more than 50% of SSI households live under the federal poverty line. As a result of this, it's about 51, 52%. If you use the supplemental poverty measure, which a lot of us in the kind of the Wonko sphere use, that number is somewhat more like 30 to 35%, but it's still kind of a shockingly high number for folks who are essentially disabled, unable to support themselves fully through work, penalized when they attempt to work,
Right.
and dealing with a lot of severe challenges.
And I can say by representing these folks over the years is they feel just as trapped as how you describe it. Is that okay? This is not enough money for me to live on, but if I try to make more money to live on, I'm going to get kicked off the program altogether. If somebody helps me out, I'm going to get kicked off the program altogether. And just they're caught in this box where, and again, that's assuming that they have any other kind of support. But if they don't have any other kind of support, and maybe they're not at the risk of getting kicked off, but that money isn't enough for them to pay their rent. And you mentioned the when I was reading about this the first time, I was reading about all these state supplement programs. I was like, what state supplement programs? When it was created, I guess they existed, but there's no such thing in our state in Indiana, and I guess many others to supplement that $9.94 a month.
So the typical person, if we're talking about the typical state, the median state, spends an amount of money on SSI in terms of benefit supplements that's roughly 2% of total federal spending. In aggregate, all the states are spending about 9% of the total federal budget on this for SSI, and back in 1974 it was more like 46, 47%. So it really has gone away. Most people are not receiving any kind of additional federal state supplements, and when they are available, they're often limited to a subset of cases. So the typical person is really getting by only on this federal benefit, which the maximum is set at roughly 74, 75% of the federal poverty line. Because
so
again,
by definition, you are not going to be able to afford to live.
If this is what's the only thing that's coming in, you're not going to be able to survive. You're not going to be able to survive and thrive.
And can you talk a little bit about the idea of a marriage penalty? And we do see some folks who both their spouse and they are both living with disabilities.
Well, there are about, I think, 500,000 people, 400,000 or 500,000 people on SSI who are married couples. So about 250,000 married couples, people who are receiving SSI. And as you can see in the way that the asset test is set up, it's $2,000 for individuals, $3,000 for couples. It doesn't actually double, right? So if you have two people, you only get a 50% more increase on your asset test, and your benefits certainly don't increase. Your benefits don't double either. So it essentially puts you in a situation where if you have become married and you are now a couple, then you're actually going to get less money than if you were two individuals living, separately in the same household. Which is of course something that even people on the political right have noted as being, something that needs to be addressed.
Yeah, and anecdotally, again, we see it all the time. People who are longtime partners would love to be married, but they can't take this financial hit by doing so.
How to afford to get married because the program will punish you for it. Right?
Yeah,
so,
yeah. And Stephen, we're talking about the people who are actually on the program, and again, we see these folks too who are actually living with a disability, pretty profound, and can't work, and they're not on the program, and they've applied to be on the program. So can you talk a little bit about how difficult it is to get on the program, the timeline, that type of thing?
Well, we do talk about this a bit in the paper because, there are a lot of people who identify in the current population survey, the American Community Survey, et cetera, as having a disability, but not receiving SSI or receiving SSDI. And part of that is that there are really long waits to get onto the program. So to get a disability assessment that will determine whether or not you can receive either SSI or SSDI. So the typical first assessment. So we're not talking about appealing the case or whatever, or usually takes somewhere in at least prior to the Doge cuts, which we can get into later, took somewhere in the realm of 8 or 9 months. And then, of course, if you add in appeals, this could go on for years. Martin O'Malley, who is the previous Social Security Commissioner, had a statistic that in 2023 that and earlier that typically something like 30,000 people died every year while waiting for their initial assessment.
Wow.
So
Wow.
there are people who are sitting there in the queue, dying because the Social Security Administration has had longstanding trouble in terms of and to some extent neglect in terms of its administrative capacity.
Right.
And that's only gotten worse over the last few years since Doge came in and cut 14% of the workforce.
Right. Yeah, and as you say, I appreciate you being willing to talk about that a little bit today too, that this is in some ways the 8 or 9 month delay is the good old days, or maybe 30,000 people dying each year while waiting for the government to respond. Just in case we didn't define that already, when folks, to correct me if I'm wrong, when folks apply for supplemental security income, they're applying to the Social Security Agency, is the agency that's reviewing it. And you mentioned SSDI, which is Social Security Disability Insurance, which has the same standard if you are living with a disability and prevents you from work, then you're eligible. So it just depends. We won't need to go down that rabbit hole, but whether folks have worked enough to pay into the program to get Social Security, et cetera. But there are folks living with a disability either way, right?
It does. There is one important thing which will come up, I guess, later in this conversation, which is that unlike OASI, old age and survivors insurance, which is what we typically refer to as Social Security, and unlike SSDI, SSI is not funded through a trust fund.
Hmm.
It is funded through general tax revenue, and as a result of that, it actually doesn't have the same restrictions um, the sort of legislative restrictions that are attached to what we call the Byrd Rule in terms of reconciliation acts. The reconciliation process in Congress creates a system where you can pass certain types of reforms with a straight majority rather than through a filibuster-proof majority. But it very specifically says, but you can't reform, you know, Social Security programs through this. But when you actually dig into it, they mean OASI and SSDI. SSI is actually reformable through a simple majority in a reconciliation bill, and that does, I think, at least for some advocates, suggest that there may be a path forward for.
Yeah, yeah. So that's a let's go to that, right? We've we've done the doom and gloom, and the
Mhm.
theme of the podcast is we can do better, and maybe we can do better by passing a piece of legislation that you've analyzed. So, can you talk a little bit about the SSI Restoration Act?
Sure. So there are two, I guess, major initiatives that are out there right now and that are periodically reintroduced. There is something called the SSI Savings Penalty Elimination Act, which is it just focuses in on the asset limits, essentially taking that $2,000 for singles and $3,000 for couples and turning it into $10,000 for singles, $20,000 for couples, so they're getting rid of the marriage penalty, and then indexing that for inflation going forward, so that the asset limits look more like what they were meant to be in 1974. And that one is bipartisan, fairly inexpensive, probably would cost about $1 billion a year to actually, like in terms of costs, and has an enormous number of, I guess, businesses and bipartisan groups sort of endorsing it. The SSI Restoration Act is something that was introduced in 2021 and in 2024, which is the version that my colleague Jack Landry and I investigated, and then just recently in 2026 by Elizabeth Warren in the Senate, and then Representative Grijalva in the House. And that includes, as part of its text, the SSI Savings Penalty Elimination Act. It also goes further in a variety of ways. It excludes the retirement accounts entirely from the asset test and says 401ks and IRAs and so forth are separate and they're no longer part of this. It takes that the income disregard, that's $20 a month for unearned income, and turns it to $150. Turns the $65 for earned income to $487. Again, indexing both by inflation and trying to sort of mimic what it would look like if it had been advancing over the last 40 years. It gets rid of what's called the in-kind support and maintenance provision from income calculations, where essentially if your family is giving you things like, rides and babysitter services and food and so forth, that can actually be counted against your benefits in certain instances. And then it takes the maximum benefit for a single recipient from where it currently is at, the 990, and it sets it to the federal poverty line for a household of one, and then sets the maximum benefit for a married couple, both receiving SSI benefits, to double that. And again, indexes all that for inflation. So that is a huge change to the program in terms of its generosity.
And I will say, just in terms of what, my ears perked up when you talked about the significant increase in the maximum benefit level, because we were talking before we hit record, and that what we see in eviction court, it's always amazing to me how many people are making 994 just work. They're, somehow, again, they're paying more on their rent each month, which kind of mathematically doesn't make sense, and makes you wonder about where maybe they have to bend the rules to survive. But they're making that work. But there's so much on the edge. The reason we see them in eviction court is because something happened, right? Somebody, a family member needed help, a car broke down, had to be repaired, something happened. But boy, increasing that 994, it's amazing how well people can budget and poor people can budget. And so just increasing that maximum amount a little bit, our experience observation would be that's just going to really be a huge difference in terms of people staying housed among all the other aspects of poverty. And though that's just our anecdotal observation, you've crunched the numbers. You and Jack Landry crunched the numbers and said, here's what the impact's going to be. So what did you find that the impact would be if this legislation passes?
Okay, so just to give you a sense of what we're doing, we're looking at the current population survey. Every year they have a report called the Annual Survey of Economic Conditions, what we call the March Supplement. And this is a huge sort of nationally representative survey with hundreds of thousands of respondents. And in that specific, the ASEC, what we call it, they actually do ask about SSI receipt and all sorts of other benefits receipt, finances, savings, et cetera. So it allows us to actually get a good sense of where people are at, people who are and who are not receiving Social Security. So we can take that and, using some statistical magic, we can sort of project it out to what the whole population looks like currently. And then we can introduce changes. We can say they're receiving, X number of dollars every month, according to what they are saying. And we can look at the calculation and say, based off of that, that's correct, because we know that from the income that they're reporting, and we know from the means testing and so forth that that's about what they would receive. So we could say, now imagine that we've changed the rules of the program and we give people additional money, or we change the rules of the program in such a way as to change their economic conditions in some way. As a first approximation, what's that going to do? So when we look at that data, we found that there are roughly 6.1 million SSI households. And we're using something called the Supplemental Poverty Measure, which is an additional way to look at poverty in the United States that takes into account other benefits and so other costs that are really not part of the federal poverty line. And we find that about a little more than 29% of the households are living in poverty as defined by SPM. And that's versus about 13.3% for households in general. So that's 13.3% is about the overall poverty rate for the average household, if you're just looking at households overall in the United States. And we find that if you introduced the SSI Restoration Act, or at least the provisions of the SSI Restoration Act that we were looking at, because we didn't have the data to look at the asset provisions, just the changes to the benefits. The number of SSI households would increase to about 8.7 million, meaning that there are a whole bunch of people who are now going to be eligible for the program that weren't previously eligible because they had too much income, essentially, and they kind of topped out and went to a $0 benefit. So there's about 2.6 million additional households that are going to be able to receive this benefit, and the poverty level for SSI households would drop down to 11.8% versus the overall poverty level in this scenario of 12.4%. So we would bring it, slightly below, but essentially roughly in line with poverty overall. Now, obviously, you can look at the poverty rate in the United States of 13.3% or 12.4% and say that's still too high. But the point is that people on SSI would no longer be outliers, like gross outliers in terms of their poverty. They would have poverty rates roughly comparable to the typical household under this sort of scenario.
Yeah, and that's just huge. As we said, to qualify for SSI really condemns you to a poverty life now, and it unfortunately condemns you so many times to homelessness or to being evicted. And this would change according to your data. That's amazing.
Sure, yeah, and I mean, we also tried to quantify to the extent possible, what's doing the most work here. What if we just took different pieces out of the bill and only pass those? What would those do in isolation?
Yeah, which does happen in the legislative process, right? The sausage gets made.
Right?
Yeah.
And I think the less costly and less, I guess, radical reforms, not surprisingly, don't do as much, right? So what if we were just going to change the earned and unearned income exclusions, so that disregard goes up? Well, that does something, but it takes the 29.2% poverty and it just brings it down to 26.6. Or what if we just get rid of the in-kind support and maintenance provision? Well, if you actually look at the data, in our data, we kind of verified it, but if you go and look at the administrative data, only about 9% of SSI households are typically impacted by that for a variety of reasons. So it's not going to have a huge impact. And again, when you look at it, 29.2% goes down to 28.9%. It really doesn't do very much. The benefit increase, if you just increase the benefit in the way that they mentioned, the poverty line and then double the poverty line for couples, that just by itself would bring the poverty rate among SSI households down to 16.9%, which is still high, still higher than the overall, but it's essentially 70% of the benefit could be just from doing that. So it really shows you this isn't a free lunch thing, right? If you really want to help folks, you can't tinker at the margins. You really do have to increase the benefit. That is where you're going to get the most impact on people's lives. And I think that sort of is intuitive, and it fits with what you're seeing on the ground as well.
Yeah. And
Yeah.
so that so the U.S. poverty line, just for context for folks, for one person monthly, we talked about the maximum benefit for SSI now being $994. Would that be 1,300 something a month? Am I right about that? Which again, that extra 300 and some dollars, anecdotally, what we see, folks that just would keep Dorothy housed. It would keep all kinds of folks housed that are, not to mention fed, not to mention able to afford medications and things that aren't covered um, by Medicaid or Medicare. Um, yeah, that's amazing. And as you said, the numbers bear that out, right? That's the big piece of the legislation, just increasing the benefit level.
It is, in fact, the biggest piece.
Okay.
If you look at the cost of this program, this sort of package of reforms, this would be the adding about $60 billion to the federal budget each year. The federal budget is literally in the order of around $2 trillion. So this isn't a lot. This is not a lot of money. It represents a very large increase in the amount of money that we spend every year on SSI, which is only more like 30 or $40 billion. But but it would again, it would cut poverty by 60% for the 7.5 or almost 7.5 million sort of recipients and their family members who are currently sort of struggling with this very inadequate program.
Yeah, and I
The benefit,
appreciate that context of $2 trillion budget. We actually have had on the show a defense industry expert talking about the huge military budget. I think $60 billion was the first 6 weeks of the war in Iran. There are other ways, and then we're going to have folks who are tax experts talking about different ways to adjust the tax code, enforce different parts that aren't being enforced now, taxing the rich, and the money's there, as you say, if we decide this is a big enough priority.
yeah, I mean, I'm a I'm a FDR style social democrat, so I would love to see a very expansive safety net. But but this is well within, not only just well within our means, but well within the sort of status quo kind of business as usual way of doing things. I think like $60 billion is a very small amount of money considering the sort of impact that we're talking about. I do want to say though that, and we talk about this in the paper, it is very expensive to be disabled in a way that these surveys and these measures like the supplemental poverty measure just really can't capture, right? They're looking at, what is the typical housing cost in this zone, or what is the typical out-of-pocket medical expense for people. And there are folks doing good work. I'm drawing a blank on the principal investigator, but the name of the project is the Disability Squeeze. It's being run out of SUNY Stony Brook in Long Island.
Disability squeeze.
Disability Squeeze, and the
Okay.
idea is that it costs a whole lot to be disabled, even to get for transportation, for food. People end up for all these sorts of small medical expenses that are not typically captured in surveys or that covered by insurance. On the order of 30% more to do a lot of the things that people take for granted. The poor pay more, the disabled pay even more. So when you think about that, and then you say, hey, well, this is going to take the poverty rate down to 12.8%, and dichotomous, it's going to take a bunch of people below that level and move it above that level. That doesn't necessarily mean that they're going to be thriving as a result of it. It's very important aid, very obviously to lift people up above the poverty line. But as I think we say in our report, like our goal when building policy for folks with disabilities, for the elderly, for children, should not be just to sort of game a particular number and say we got them just above the poverty line, so everything's okay now. You really do want to think about the kind of material hardship they are still facing in their daily lives and whether or not they can thrive given this sort of support. So we look at this sort of thing like the SSI Restoration Act and say, you know, these sorts of provisions, you know, getting rid of all this crazy paperwork, the administrative burden associated with the in-kind support and maintenance provision, the crazy asset test churn, the limited benefits. We should definitely think about doing all those things, but we shouldn't, I guess, you know, limit our imagination to that sort of stuff, because I think the program could potentially uh, need you know, a broader review for how it's structured and how it could be, you know, made more effective and I think more dignified for people. You know,
Yeah, yeah.
yeah.
And just to underscore when in all this discussion, politically charged discussion of work requirements and able-bodied folks, these are folks who have been determined by a federal government agency through a time-tested analysis to be living with disabilities that are serious enough that they cannot work. So and again, they're prohibited from doing so, or they're going to get kicked off the program. And so by bringing that benefit up to poverty level seems, like you say, that does not seem like it's a very controversial point. But so hopefully,
I do
um,
want to point.
go ahead. Go ahead.
So I just wanted to follow up on that very quickly. I apologize. Which is that I am part of the Disability Economic Research Consortium that Roosevelt and the National Academy of Social Insurance have produced to do research and to some extent, to the extent that we can, support research um, and researchers on this. And a huge part of the work that we've been doing and the conversations we've been having have been around those work reporting requirements. And you might say, hey, wait a minute, that doesn't make sense. Why would you be doing that? Because as you just noted, these folks have been determined to be exempt from that. But the problem is, we know that work reporting requirements on Medicaid and the extended reporting requirements on SNAP are going to hit disabled folks quite hard.
Hmm.
They're not work requirements, they're work reporting requirements. And we have seen in past times when states have implemented stringent work requirements on additional populations, SNAP and Medicaid, that a very large percentage of the people who end up losing their benefits or getting caught in regular churn are people with disabilities and caregivers, people who are on paper exempt from this, but are having a heck of a time getting the paperwork done and done on time and without any mistakes to prove to this agency that in fact they are exempt. So we
Yeah.
see a lot of people, a lot of panic, I guess, in the sort of the disability advocacy community because we know that that folks, you know, are going to be triggered as false positives and booted off this program. And
Yeah.
if you think about how hard it is to be somebody dealing with a disability or to be a caregiver to somebody who's disabled, and to also have to be doing this paperwork on the side to prove that you are one of the deserving to continue receiving it. It's kind of nightmarish, to be quite honest.
Yeah, yeah, and we've had a conversation with folks in the Center on Budget and Policy Priorities about requirements for SNAP, but as you say, for Medicaid, which in our state and many others is rolling out right now, with a whole lot of pressure to reduce the rolls both in SNAP and Medicaid, and as a result, the agency is not very motivated to make it easier for folks to prove that they can't work. Um, so I want to be respectful of your time, but if you were kind enough to offer to talk about one thing that's related, and that is, as we talked about, folks applying for SSI or having their SSI be reviewed once they're on it, go to the Social Security agency. like Social Security Administration, excuse me. And that has been, folks, it's been a little bit of time, but folks might remember that Doge, there was a big talk about the Trump administration and Elon Musk and Doge and Doge cuts. You mentioned that before the Trump this most current Trump administration, it was like about 8 month delay of folks applying for disability benefits before getting their decision, which again, by definition, these people can't work. So somehow during the 8 months, they're supposed to survive with no income coming in the door. Um, what's that like now after these cuts, the Doge cuts have happened?
So we don't have updated stats on that, in part because the Social Security Administration is not releasing stats on a lot of
Mhm.
this. But we know they cut about 14% of their staff. At least 7,800 employees lost their job as a result of this. There are 1,200 field offices, and a lot of the staff that were working in the field offices have been reassigned to handle phone calls now, like the 800 number, meaning that there's now a whole lot less time for in-person appointments. People can end up waiting a month or more to just talk to somebody. It's very common to be on the phone for hours or to put the phone down because you request a call back and wait for hours or days to actually receive something. This could be disability assessment. It could be, hey, where's my check? It could be, you paid me too much. It could be, you paid me too little. It could be, I don't understand this form because I'm not a native English speaker. There is the Social Security Administration always calls folks on SSDI, SSI, OASI, their customers, and there's
Mm.
a huge customer service problem brewing right now. And
Mhm.
can't um, you can't cut thousands and thousands and thousands of employees and then expect there not to be some kind of um, spillover in terms of service. So the truth of the matter is, even before Doge, Social Security was a neglected agency. I did like, and this is not a partisan statement at all. I don't. There just wasn't a lot of resources put into it by anybody
Mhm.
for a long time, to the point where the queues grew and the problems sort of it built up. So I think things are worse now, and it's bad because any paper on any policy looks great on paper, but if nobody gets it because they can't actually implement it, and they can't get their questions answered, they can't figure out how to get through the application process, they can't get a straight answer, then what you see on paper versus what you see in practice, there's going to be a huge disparity between those things. So a big part of, I guess, researcher focus right now is on um, the Social Security Administration and the impacts of the cuts on all of those programs, not just SSI. At the same time, the Social Security Administration used to fund or host expert panels on disability, filled with intersectional scholars, people who both have disabilities, maybe some of them had even been on SSI before, and are also sociologists, economists, statisticians. So they know it, you know, on an academic level, but they also know it on a personal level. And pretty much all of those have been, canceled or disregarded. So the kind of research that the Social Security Administration was doing or funding to better itself and to understand the impacts of its own changes, in terms of policies and in terms of staffing and administration, is no longer happening at the level that it was. So organizations like the National Academy of Social Insurance, Roosevelt, and others are doing our best to try to fill in the gaps. But when a big actor like the Social Security Administration, stops funding and providing support, that it's very hard to fill that gap. Because they were kind of the 800-pound gorilla in the room.
Yeah. Yeah. Well, it's a great reminder for those of us who may just think, "Oh, my goodness, all this government fat, oh, this government waste, inefficiencies, et cetera," that there's real human cost to cutting so dramatically and thoughtlessly. To be honest, my words, not yours. I won't put those in your
Yeah,
words.
I do think the last few months on a variety of different dimensions, not just in disability policy, but for example, food safety,
Yeah,
among others, gives
yeah,
you a sense of, actually, the government was doing important things. Perhaps we shouldn't have removed those things.
yeah, yeah. Yeah. Watch your lettuce, right? So, well, I don't want to bury the lead of frankly the optimistic tenor of what your research has been, and we'll put a title on this. But one title we've thought about is that just one neat trick can actually reduce poverty. But this one piece of legislation, one law can actually dramatically reduce poverty. So we really want to keep this in mind because this legislation could have so much impact on our client Dorothy and all kinds of people like that. So Stephen Nuñez, I really appreciate everything you're doing, the research you're doing, and what your colleagues at Roosevelt Institute. If folks are not already following Roosevelt Institute, I am a weekly newsletter. I think more often than weekly, I get the email newsletter and updates of the terrific research on economic justice is my term. I don't think that's a term you all use, but the way that the laws and public policy can actually either help or exacerbate some of the struggles that our clients and millions of other people are going through.
Thank you for drawing attention to this. As I was telling you, before we started recording, that in the large discussions around poverty, we talk a lot about elderly folks. We talk a lot about children. We talk a lot about displaced workers, and those are all important populations to support. But we often seem to forget disabled folks and the disabled folks among those populations.
Right.
This is SSI is sort of often referred to as the safety net that America forgot. So any kind of attention that we can draw to its inadequacies and the need for reform, I'm happy to see that. So thank you also.
All right. Well, thank you. Thank you to Stephen. Thank you all for listening. And we'll look forward to more discussion and hopefully some updates on the progress of this legislation. Until then, thank you for joining us. And remember, we can do better.